County's core determinants of health. Brief overview of the core determinants of health. There are 12, beginning with health services. This involves access. It's extremely important for patients in the community to have access to preventative care, including cancer screenings, vaccinations, things of that nature, treatment for chronic disease and illnesses, and treatment for genetically inherited illnesses or disease. Another determinant would be employment. Healthy attitudes equals a healthy workflow, which equals increased mental health. When you have a stressful job, when you don't have a job, you have that stress build upon, and can cause decrease in healthy lifestyle. Education and health literacy. This is so important. The more educated a person is, the more knowledge they have about their health, the more they understand concepts of keeping track of their lifestyle in terms of what they're eating, how much their activity is. If they do have a genetic disease, are they caring for that to decrease the occurrences of exacerbation of that disease? Physical environment. This involves clean air and water, but it also involves transportation availability and housing availability. When you have rural areas such as Warren County and you don't have the specialties that you need and you have to have access to transportation to get there, that can become a determinant of health. Social support networks. When you have a patient who is supported by their family, supported by their friends, even have group support such as Narcotics Anonymous or grief counseling groups or cancer support groups, the more support a person has, the less they feel alone, the more they are apt to be compliant with care. Personal health practices and coping skills. Healthy coping skills equals decreased stress, which means you will increase your health. When you have negative coping skills such as drinking alcohol in excessive amounts, smoking cigarettes, smoking other recreational drugs, this becomes a problem for your personal health. Social environments, community standards for healthy living. I can't stress this enough for Warren County itself. When I did the previous community assessment and spoke with some pillars of the community, they said that our biggest asset is the fact that we do come together for those in need. Healthy child development involves teaching healthy lifestyle, good food choices, choosing activities outside for exercise as opposed to sitting behind the screen, and teaching them good coping mechanisms so that they don't turn to drugs and alcohol or eating food that is not healthy for them. Biologic and genetics can affect the health as well. Knowing what those inheritances are early on can help prevent exacerbation and explain to patients that yes, they have a predisposition, but that doesn't mean that they are necessarily going to have that disease take place. Culture, personal culture along with community culture can affect how one looks at health, depending on where you are. If you're a Jehovah's Witness, you will not, or you generally refuse blood transfusions. Different Hispanic cultures believe in hot and cold treatment depending on what the disease is. Then they get a hot food or they get a cold food or they get a medication that's considered hot or cold. Financial and social status is said to be the absolute greatest factor in determining health. And then gender, what society believes how gender should present themselves in the terms of weight scales and obesity. Men should be bulk and women should be super thin. Warren County statistics, real quickly, our population is 40,164 individuals. Housing units available is 16,606. This becomes an issue when we start talking about rent and having the money to pay for rent, having housing, and the median rent is just over $1,000. And unfortunately, we have 9% 9.7% of our population is living in poverty. We also have 11.9% of our population that is here without health insurance, and those with disability under the age of 65 is 10.1% of the population. This is an incredible determinant for our healthcare within our population to have that many people living in poverty and that many people without health insurance. This creates an issue for access to healthcare. Patient to primary care physician ratio is 2,057 to 1 as of year 2021. This also creates an issue with access to healthcare. As I spoke before, Warren County does consist primarily of Valley Health Associates, so most of our physicians or specialties that are available, they're all connected in the Valley Health network. We do have a pre-diabetes program, but it only allows 8 to 12 participants, which creates another issue for access. Specialty care is generally outside of Warren County. Most people are sent to Winchester Valley Health, which is about a 30-minute drive, and that's going to fall over into our physical environment. Transportation is a primary issue. Warren County Corridor, which is a trolley, travels only to 11 of the most frequented areas in Warren County. It is $1 one way each fare. And then Yellow Cab charges a flat fee. Unfortunately, they are unwilling to participate in surveys and in answering questions about what that flat fee is. Social environment, as I spoke before, this is a positive effect on our community. We have our Warren County Community Center, which gives access to parks and recreation, including indoor basketball courts. There are computer labs available to the public, which is a great asset to have. Samuel's Public Library also has computer labs available. The community center does have some fitness programs for adults. There is access to 6 different parks in Warren County, various community activities that bring us together. We do fundraisers for the homeless shelter, for the women's shelter, for the men's shelter. We do parades. We do all kinds of activities to come together as a unit and try and help those who are in need. We do have the Front Royal Women's Resource Center, and we also have Ability Unlimited. This is for people who have Medicaid but aren't necessarily educated well enough to know how to find funding through their Medicaid status. So that is an incredible asset to have. Financial status, we spoke about this earlier with those living in poverty and those being without insurance. This is an incredibly significant asset that we are dealing with. Our diabetes prevention program is free, however, space is limited. Our weight loss clinic is not free. It can get quite expensive. The fitness centers have monthly fees and can also be expensive. We do have an asset that's St. Luke's Clinic. They treat people who don't have insurance at all or have very limited income, and their fees are generally between $10 and $30 depending on what their income is. They offer various physicians to see for blood pressure, diabetes. They even have a dental clinic. These are my references.